So one of the most important question that comes up because you might be needing a very high-end specialized treatment is bone marrow transplant. So as a parent, as a relative, you might be thinking, what is bone marrow transplant? So let me explain you what exactly it is. So bone marrow transplant is replacing the bone marrow. Now, where is bone marrow? Bone marrow is inside the bones. It's a thick blood which is called as bone marrow, and replacing it with a healthy marrow from the same patient or the other healthy donor makes it bone marrow transplant. Now, if you have to replace the existing marrow with the patient's own stem cell, you call it a autologous bone marrow transplant, which means you collect the stem cells from the bone marrow and you keep them into the blood bank. Then you give the high dose chemotherapy. High dose chemotherapy kills the cancer, but simultaneously it kills the bone marrow as well. And just to repopulate that bone marrow, you give back the stem cells which you have kept into the blood bank. This is autologous bone marrow transplant. This can be used in lymphomas, neuroblastomas, rhabdomyosarcomas, brain tumors like medulloblastomas, ATRTs, and it can be used even sometimes even the Ewing sarcomas and sometimes even into the autoimmune diseases. So this is in crux is autologous bone marrow transplant. Allogenic bone marrow transplant, when you have to replace the existing bone marrow by a healthy donor's stem cells. Now the healthy donor can be a brother, a sister, if they are matching 10 by 10 or 12 by 12, or a parent like that might be matching just 5 out of 10 or 6 out of 12. So we call it allogenic bone marrow transplant. Now the way to do it, first you give chemotherapy, immunotherapy and the radiation therapy to the patient that kills the existing bone marrow of the patient. Then you collect the stem cells from the brother or the sister, whosoever is the donor, and then you give those stem cells to the patient. They go inside the bone marrow spaces, they sleep over there for some 10 to 14 days and then they start working. This is allogenic bone marrow transplant. Now, if you are doing allogenic bone marrow transplant from a 10 by 10 or 12 by 12 or 100%, which is commonly called as 100%, then you call it a matched sibling donor transplant. But if that donor is not available, then you either search for a donor outside the family or you do a 50% matched transplant, which commonly known as haploidentical bone marrow transplant. So these are the different types of bone marrow transplant, the gross vocabulary which is used to explain you what they are. And the final message is, whatever the type of transplant is, whether it's autologous transplant, allogenic transplant, you should not be scared and connect or go to a center which has got good experience in it. I hope this will help. Thank you.